So hello and welcome and namaste to everyone that's joining us today. Welcome to our second webinar on living donation, which is focusing on living donation and the Hindu faith perspective. My name is Bushra Riaz. I'm your chair and I work as policy officer at Kidney Research UK, and my job entails working with the policy and public affairs. I also lead on the peer education project, educating the South Asian communities on kidney health, which is education, on kidney health and organ donation, which is deceased and living donation. And like I said, our focus today is on living donation, and I'm very grateful to speakers to give up their time and supporting us today, especially with the weather being so nice. Just to say, this webinar will be recorded and will be available on the Kidney Research UK website, which is an opportunity for others to listen at their own time. And please also do follow us on social media now, because we also have a Facebook page, we're on Twitter, and we're also on TikTok now as well, as of last week. So we'll start today with an introduction from Brij Gandhi from the Scottish Indian Mahalla Cultural Group from the Hindu Mandir in Glasgow. And thereafter, Dr. Gaudi Bhatt will also talk about the importance of kidney health and maintaining good health. And then we'll have our key speakers, Prafula Shah and Jen Lumsden, which will be discussing about living donation and how Prafula Shah donated her kidney to her niece. So what I'll do is I'll hand over to Mrs. Brij Gandhi to say a couple of words before we start today. Over to you, Mrs. Gandhi. Oh, you just unmute yourself, Mrs. Gandhi.
For things. Thanks, Bushra, for giving me the space. And I must thank my ladies from Glasgow, because it's a lovely weather. They can't go out. 1 hour now they're going to spend with us. So thank you, all of you. And Bushra, once again, thank you. I know we had many talks about donations, and if we want to give any part of our body parts. And Bushra has worked very hard with the Scottish government to do things with Charyaji. And I am so glad that things have been good, and Bushra can talk. Can you talk, Bushra, a little about that in the end, just to give a feel of what it was? Yeah. So I'm so happy about it, because we were involved with Kailash, and Bushra, Neerja started it. Yeah. But I'm very glad Charyaji has done very well about it. Yeah. You know how important it is to donate a body according to Hindu religion. Hindus hope to be liberated, you all know, from the cycle of rebirth. But seva, donating, is the highest form of especially donating parts of your body to save another life. One can participate during and after life. I think our thoughts are what we have been told, or how it is going. It's so different, but now it's so different. So I have changed my mind, and I've signed about 2 years ago, and I didn't want to get anything from my body parts. It's my experience. But when I got operated, with my ovaries were taken, and then the heart stent and all that, I changed my mind. I said my body is already in wiggles and it's going round and round. First my heart attack, and then stents in my body, and ovaries were taken. So there's no question of liberation. There's already parts of their damaged, some parts. So I have actually signed 2 years ago. I didn't want to tell you. It has taken me long to actually tell my family. They even didn't know that I had done it. So girls, Bushra, it will be lovely to hear from your client. Thank you so much.
Okay. Thank you, Mrs. Gandhi, and thank you for sharing that as well. It's a very personal moment, shall we say, and thank you for sharing that with the wider group. Okay, so without further ado, what I'll do is I will hand over to Dr. Gaudi, and what I will do is I'll be on there. So yes, so I'll hand over to Dr. Gaudi. She is a GP in Barhead, Glasgow, and has 17 years experience, qualifying from India and trained mainly in the northwest of England before moving to Glasgow in 2007. Dr. Bhatt works in a busy practice alongside 5 other GPs and is involved in teaching and training of 50 medical students. an examiner at the University of Glasgow, and also an interviewer of candidates looking to do medicine. She is a mentor for MCR Pathways, which is a charity organisation which helps teenagers of deprived backgrounds, both educationally and emotionally, to enable them to pursue college or university degrees after leaving school. Her husband, Ram Kathuri, is an interventional radiologist and is very involved in non-invasive treatment of kidney disease. They have a daughter aged 15 who is in S4, and Dr. Gowdy is aspiring gardener, keen runner, and trying to get better at yoga. We'll just hand you over to Dr. Gowdy, and I will share my screen so that I can put up the, just bear with me.
Thank you, Bushra. Thank you very much for having me, and thank you to everyone over here. And I don't know if I'll be preaching to people who already know about all this, but bear with me if you find it a bit patronizing. But anyway, I thought I was asked by Bushra and my friend Radha, who many of you might know, about maintaining, kidney disease, and a little bit about what the kidneys do from a medical perspective. So thank you, Bushra. So how do I move the? As I go on, it'll do it for me. Excellent. So I just thought I'd start with a quote that, obviously prevention is better than cure for most things. And that leads us on to kind of, that this slide showing us all of various ethnic backgrounds. In particular, kidney disease affects people of the BAME community. So if we just go on to that. So the kidneys, basically, most of us have two kidneys. They are responsible for keeping our body in good check. The main functions of the kidneys are to remove excess waste, excess water, and this gets eliminated in the form of urine. The kidneys help us produce hormones that help us keep our blood healthy, that prevent us from getting too anemic, which can then cause tiredness. And they also help produce vitamin D in an active form that helps us keep our bones healthy, prevent us from having breaks in our bones and fractures. And also, quite importantly, it helps maintain good blood pressure. So causes of kidney disease, there's a mnemonic for this, which is DOUGH, as in DOUGH. So diabetes, obesity, urine infections or other infections of the kidneys, conditions like glomerulonephritis or nephrotic syndrome, which can cause swelling and edema of the body, heart disease, and hypertension. So these are the main causes of kidney disease. For some reason, some of it we don't know why, but unfortunately, the BAME community, so Asians, ethnic minorities, Middle Eastern and Afro-Caribbean, are at highest risk of kidney disease. There is some element of a genetic predisposition, but also in these communities, diabetes, heart disease, and obesity are much more prevalent. So my kind of grandparents, great-grandparents probably had a lower incidence, possibly because of the better lifestyle in that age, in that time. People were walking more, not relying on cars and buses, and not eating as unhealthily as we do now with preservatives and fried foods. So all that leads to, unfortunately, Asian people having a higher proportion of diabetes. So it's kind of triggered a crisis, really, in terms of health affecting kidneys. And across the UK at the moment, there are 1/3 of people from BAME communities waiting for a transplant. The figures speak for themselves. 3.3% of people who are registered waiting for a donor were Asian. And overall, only 28% of transplants were in ethnic minorities. There's a longer waiting list as well. Average is 2 years for a Caucasian person in the Caucasian community, whereas it's 2.5 years in the BAME community. There's a critical shortage of donors at the moment. So this has had a huge impact on Asian communities. So many of us lack social support, lack family support over here. Many kind of young people who are affected by kidney disease are kind of still in their prime life, so they're the main breadwinners. Still, in Asian communities, even this day and age, a lot of people may not want to speak about their illness. Mrs. Gandhi was sharing about how she's had heart problems and stents and things like that, but still a lot of people are not open and upfront about medical conditions. Language forms a big barrier. I see that in the community that I work in Barhead. Asian patients will often just keep their medical problems to themselves, whether it's medical or psychological, because they just don't want to talk about it. Certainly, COVID has had numerous delays. We were talking earlier that this marks the second year anniversary of the pandemic. And again, because of the lack of face-to-face and difficulty seeing your doctor, maybe people may not come forward when they've got problems. Okay. So what can go wrong? Basically, as we said, we've got two kidneys. You can have kidney infections. You might have a young lady, or you might have middle-aged women who have urinary tract infections. You can get kidney stones quite often just as a genetic thing or from not drinking enough fluids. Certain infections might affect the very core of your kidney, which is called glomerulonephritis. Some people may, as a congenital thing, have cysts, which are tiny fluid-filled sacs within the kidneys, which can cause long-term problems. And of course, chronic kidney disease, which all the above can lead to chronic kidney disease, including diabetes and hypertension. So the way we measure how your kidney function is via a blood test. So your doctor might order something called Use and Ease, which is the urea and electrolytes in your bloodstream. And that levels, when that's done, it also calculates something called a GFR, which is the glomerular filtration rate. So normally we would expect this to be well above 60. In fact, they don't really, for GPs, when we get results, they don't really give a value of 90. If it's over 60, it's normal. If it's below 60, it can be mild, moderate, or severe. The concern that we have is patients who start with kind of like a level 3B, 3A to 3B, and then severe kidney disease when it's a level 5, CKD 5, where the GFR is less than 15, which can be quite dangerous. Okay, so as we said, we can do a blood test. There's also a urine test. So your GP might ask you for a white bottled urine sample, and that measures the albumin or the protein in the urine. So if you get a result that says it's not detected, that's good. We don't want to see albumin in the urine. But if you get a ratio where there is some amount of albumin in the urine, then that's not so good. And your GP might give you advice and medication about what to do next. Okay. So the most important thing is lifestyle. So exercising more, eating healthier, watching what you eat, and being careful with your diet and exercise. In terms of medication, if you have diabetes, trying to control it, being compliant, so taking regular medication, attending your doctor or practice nurse regularly for blood pressure checks, cholesterol checks, and weight management as well. Some of the medication that's used to control kind of your blood pressure is, as well as your kidneys, is a tablet called Ramipril, which some people might be on. It's protective towards the kidneys, and it helps prevent kidneys deteriorating and maintaining your normal function. In people who've reached, unfortunately, that level where it's below 15 millimoles per liter, your GFR, you can classify it as CKD5 then, and treatment options initially would involve dialysis, followed by transplant. Unfortunately, once you reach CKD5 or even CKD3, there is no cure for it. It's just controlling it with medication and lifestyle. Okay. So that's just a picture really to show you what a normal kidney looks like. And unfortunately, when you do have kidney disease, the kidney's smaller, so it's shrunken, it looks more shriveled, it's hardened, the blood vessels, the arteries get a little bit more wider, they look harder, they're firmer, and the kidney just doesn't work as well, unfortunately. Again, that's just things that can go wrong with the kidney. So you can have the cysts that are outlined. That's basically nothing you can do about it once you have a diagnosis of polycystic kidneys. These are cysts that you're born with, unfortunately. You can also have adult polycystic kidney disease where the cysts form in adulthood. Stones, which unfortunately can damage not just the actual body of the kidney, but they can also damage the tubes through which you pass urine. Several infections over a period of time can cause scarring of the kidneys. You can see that kind of top part where there's pus and scarring and shrinkage of the kidney. So yeah, and kind of plaques can form in the blood vessels, which make the blood vessels in the kidney hardened. All of this affects things. So in terms of transplant, you can have a live donor, which is the most ideal. That's somebody who's healthy and who's willing and generous to give up one of their kidneys, because we can all survive even with just one normal functioning kidney. So live donor is certainly the best way of going forward and having the best chance of good outcomes in terms of long-term kidney function. A deceased donor, obviously somebody who's passed away, they can donate their kidneys. So in Scotland currently, we're all in the opt-out, which means we're all registered donors unless you actually opt out of the system, and that law changed recently. Who can get a transplant? Obviously, there are waiting lists. So depending on how severe your condition is, you will be put on a waiting list, and your priority will depend on the waiting times, matching times, as well as ethnicity, which is why this talk today, to kind of increase awareness amongst Asian communities. So as long as you can withstand surgery, once you've had a transplant, you've got a brilliant chance of it being successful, along with medication to suppress any rejection and things like that. So that kind of brings us on to kind of who can't have it. So people who are well fit, if your renal function is well over kind of 15 and you're maintained quite well in the 30 to 45 range, then it's just lifestyle. But if you're below a certain level, then you would be considered for a transplant. So really, that's kind of the gist of what can go wrong with your kidneys and who is vulnerable. And I think the mainstay is really just keeping a good, healthy lifestyle, not being fearful to talk about what your problems might be, and getting help when it's needed. Yeah, no, thank you very much. And just the last slide, obviously, to talk about encourage people to come forward and donate.
Thank you very much, Dr. Gowrie. That was very informative. Thank you. Very interesting as well. And a short summary of, I know a lot of the ladies probably have heard this before, but it's always great to have that reminder about the importance of looking after our kidneys as well. So without I will just carry on with our next speaker. Thanks very much, Dr. Gowrie, again. So our next speaker is Prafula Shah, who is a communications consultant by profession and works with many public sector organisations delivering internal and external communications for a range of projects. She is a living kidney donor and an NHS blood and transplant ambassador. Prafula has successfully raised awareness of organ donation in hard-to-reach communities for over 4 years. An award-winning Jane community leader, Prafula also volunteers for charities, helping to deliver events and projects, including a series of health awareness webinars. This work has seen her build strong relationships within the community, whilst raising awareness and starting community conversations about often challenging topics. We also have Jen Lumsden, who is a registered nurse and has been a transplant coordinator since 1997. Jen completed her PhD with the University of Edinburgh with nurse-led research into quality of life issues in living donor kidney transplantation in 2006. She specialised in this field. She has been specialising in this field for the past 25 years, and is working within the Scottish Government to raise awareness and improve equity of access to information in Scotland about living donor transplantation. So I will hand over to Jane and Prafula, so we'll be able to hear from them. So over to you, Jen and Prafula.
Thank you very much indeed. Thank you. Now, I think we're going to start. I think Prafulla is very kindly going to just give us an outline of her story, and then we can have some question and answer sessions. Thank you, Prafulla.
Thank you very much. Thanks, Jen. Thank you, Bushra, for organising this, and to Kidney Research UK. Really important topic, and it's so important that we understand everything that is involved in this. So I'm going to talk a little bit about what made me do this. So our kind of journey with this topic began more than 20 years ago. My niece was born with one kidney. And as a family, we always knew that sooner or later, Shakti will need to have some intervention, which we've just heard about from Dr. Gauri. So either dialysis or go on the transplant waiting list. The kidney she did have was also not functioning at 100%. And we were told as a family that by the time Shakti is maybe 12, 13, she may need to go on the transplant waiting list or do dialysis. Shakti, in fact, was 24 by the time her kidneys got to that really serious stage. Her kidney, one remaining kidney, got to that stage. So she went through education, went through school, got all of her A-levels, did her degree at York, and did a master's at King's College in London. And it was in the summer of 2017 that her kidney function went down to 5%. And this is when we all then had to have a serious conversation about what needs to happen next. And like a lot of people who are in this situation, Shakti was not actually very open about talking about this with us as a family, very hesitant in getting anyone to do a test for her. And this often happens with people who are in this situation. They don't talk, they don't want others to do the test that are close to them. But we as a family had this conversation, and it was on the back of our minds for a very, very long time, as I've just said. So we decided we'd do the test, and many of us did the test. I have quite a large family, 4 sisters, and some of Shakti's friends did the test as well. None of us, unfortunately, were a match for Shakti, including me. So we looked at other options. So my journey really started with finding out that I wasn't a match for my niece. I had stepped up to donate my kidney to her, but it wasn't going to happen because we were not a match. And it's not just about matching bloods, it's actually about matching other things, including tissue typing, which is why it's so important that a donor and a transplant waiting person from the same community often find matches are much easier because the tissue typing works better, your DNA is identifiable. And so we looked at other options, and with the team at Royal Free in London, we found out that we could actually look at the UK kidney sharing scheme as an option. And the scheme works across the UK, giving people an opportunity where they may not have a direct match in the family, but somebody else could be a match to them. And essentially, the easiest way I describe this is like a computer program. So you go into a database with your details, as long as you have somebody who is willing to donate for you, your details and their details are entered into this computer program alongside everyone else who may be in the same situation in the UK. And so that's what we did. And in January of 2018, we were entered into this kidney sharing scheme run. So the runs happen 4 times a year, and the one for us was the January one. But the journey to that point for me was a lot of blood tests. In fact, I think they took all my blood. I was always complaining, stop taking all this blood from me. I haven't got any left now. So I must have had like several whole body MOTs during this time as well. So the hospital are really thorough in checking everything. And I went through lots and lots of tests, scans as well, looking at my weight, looking at my general health and lifestyle. And I was considered to be in good health, and had 2 very good kidneys that were functioning really well. So giving one wasn't going to be a problem for me, hopefully, in the future. And so we went through all of this, and I was found to be healthy. I can donate. And this is really important. The tests are done to make sure that you are in that situation where you are able to donate to, whether it's a friend or a family member. But of course, you could donate to somebody you don't know as well. That's possible too. So we went into the kidney sharing scheme run in January, and a match was found for Shakti from the first run, which, you know, I still think was a bit of a miracle, because I found out since then that a lot of people may go into those runs many, many times before a match is found. And eventually our surgery happened in March 2018. So in fact, I've just celebrated my 4th kidney anniversary, or kidney giving anniversary, as I call it. And that day, 6 surgeries happened around the country. So there were 6 people in our chain, and my kidney was taken in what looked like a pizza box, but it wasn't a pizza box. It was a proper medical box. And it was given to somebody who'd been on the waiting list for a while. I don't know who that person is. I have no idea who they are. All I know is that they were in their 40s and they have 2 children. So I have, by donating my kidney, not just helped Shakti, because Shakti got a donation from somebody in that chain. I've also helped somebody else. And that's why I think the kidney sharing scheme is a fantastic scheme. Not many people know about it. Every time I start talking about it, people are amazed that it exists. For us, it was an absolute savior. Shakti's life has been transformed. And when I look at her now doing the things that she is doing, while I'm living and watching her do it, it has given me, I guess, a purpose, a renewed purpose to say, actually, what can I do to help other people who may be in a similar situation? And so I became an organ donation ambassador for NHS Blood and Transplant. And I spend now a lot of my time, as well as working full-time and caring for my mom, I spend a lot of time doing events like this.
Thank you so much. An absolutely fantastic description of the kidney sharing scheme. I think we'll borrow that from you. It's, yeah, really, I think you highlighted all these points. Can I ask, you know, I know that the decision making, sometimes the donor said, well, I've decided I'm going to go ahead and I want to give a kidney. But then that can impact upon other family members as well, and partners and parents, etc. How did your family feel about you going ahead to have this operation to help your niece?
So as I said, we as a family were quite open about this, and we've had lots of conversations leading to that point. But I was very nervous of telling my mom, and I, in fact, didn't tell her till the week before the surgery. And the reason I was very nervous of telling her was I didn't know how she was going to react. Obviously, she was going to be worried about me. She was going to be worried about Shakti. But I'm also a carer for her. And I think I was worried that she may start worrying about how will that impact us doing that. So I actually told her a week before the surgery. Everyone else knew in the family. So it was quite a tense time for us, actually. She was absolutely fine. She completely understood why. And you know what? She sat me down and she said, Beta, you are doing the biggest seva that you could do. And that whole ethos of seva, which I just want to talk about and touch on slightly. Mrs. Gandhi mentioned it when she was just referencing her work and the work of the community. I think doing something good for others is seen as seva. And I think the biggest seva that we can do is actually give somebody else a life, because let's face it, when we're gone from here, our organs aren't going with us. They're going to be either cremated or buried somewhere. They're not going to be helping us, but actually they could help and transform 9 lives. For me, being a living donor and seeing all of this happen and transforming Shakti's life has been like an amazing thing. And so I think in the Hindu faith, Seva has got a very, it is up there amongst the things that you do while you're living or when you're no longer living. So I think as a form of Seva, organ donation is definitely something the Hindu faith supports. Other faiths, so I'm from the Jain community, and what you see behind me is a library of Jain books. Is the Jain community saying we are very much about giving others a chance when we perhaps can do that. So we talk about ahimsa and anukampa. Anukampa is dan and seva. So having that benevolence and helping others to live is also part of our Jain philosophy. So very much the faith supports this. And I think people who are maybe a little bit hesitant should just maybe look at finding out a lot of information. So that's what we did as a family, to find out everything there was to understand living donation. And that did help us, definitely.
Thank you so much. And I think for some people, the thought of going through an operation when they are fit and healthy, how did you find actually being in hospital when you might not have used to being in hospital, and your recovery? How was that after the operation?
So I'll tell you an interesting story. My consultant said to me, before you sign the final consent, he said, you could die doing this. And I was, well, yeah, I could die crossing the road. It's not, yes, the thought of having surgery is frightening when you're completely well. But I wasn't really thinking about me. I was thinking more about Shakti and what it could do for her and how it would transform her life. Our recovery actually was remarkable. I was back at work in week 7.
Okay.
The hardest thing for me was not being able to drive, because you're not able to drive after having this surgery. And that's not because you physically might not be fit. It was explained to me that your insurance may not actually cover you, because if you did an emergency stop, you may, so basically the issue was 2 things. You've just had surgery, and doing the emergency stop might not be great for the stitches.
Yes, absolutely.
And your insurance also may not cover you. So the biggest challenge for me was not being able to drive and having people to take me to places I needed to be at. But otherwise, my recovery was really good. My mom looked after me at home. Shakti's mom looked after her at home. And actually, I support a lot of people going through the donation process now. And often, if you're donating, say you're a wife donating to your husband, both of you are going to be in that situation at the same time, both trying to recover. So there's a lot of things you can do to kind of prepare for living donation as well, which is, first of all, you can set the date that suits you. You can prepare for things like meals, and you can freeze meals. You can prepare for having someone else stay with you for a little while just to take care of you. So living donation makes a lot of sense in a number of ways, from that perspective as well.
I think that's right. And for the recipient as well, a kidney from a living donor transplant, especially if they can avoid dialysis, the long-term outcome is so much better. And the work that you're doing, raising awareness, is so important, really, just to get people talking about living donation. Our time is almost up, but just briefly, what would you say to somebody who's thinking about becoming a living donor?
Phone me, get in touch with me. No, seriously, I think what I would say is find out everything you can about it. Go and get the conversations going, talk to your family, talk to your friends, because actually my friends were really supportive. I was really lucky, but I have heard stories where friends go, oh, you don't want to be doing that. What if you're not very well afterwards? That kind of conversation. So I think the community talking about it is really important. I think if a younger member of the community wants to do this and the elders are a little bit unsure, find somebody like me to talk to them, because that helps. I've had people say, but I want to have babies. I won't be able to do that afterwards. Not true. You could still have babies. after donating a kidney. In fact, I have met a wonderful woman at Royal Free Hospital, one of my checkups, and she's just given birth to her third daughter after donating a kidney to her brother many years ago. So there are a lot of kind of misinformation, myths surrounding this. So I would say make time, find out the right information, work with people like yourselves, Jane, in hospitals, Jen, coordinators who are amazing, and mine certainly was. I mean, I think she's a complete angel. I don't know how she does it, but she does a truly wonderful job. And I think you are there as a support for those people. And I have had an amazing experience doing this. So I would say, don't kind of just go, oh, I'm not a match, and then walk away. You're not a match, but actually there is the kidney sharing scheme, and consider it definitely.
Thank you so much. Your amazing story. Really appreciate you sharing it. Thank you.
Thank you,
Thank
Prafula. Thank you. It was amazing. Honestly, it's overwhelming just how much how much we do. We do a lot for our families. I know, I think overall, but to do that is over and beyond, Prafula. And bless you with good health, and your niece too. I think we've got one question that's just come through from I think there's no name, it's just Lenovo tab. Oh, you're on mute. Oh, I think she's on mute. Yeah.
Can you hear me now?
Yes, can hear you now.
Yeah, okay. I just wanted to hear, is Prafulla, is that the right name I'm pronouncing right? Is she has to be a lot of medication after the donation?
That is a brilliant question. And I get asked it quite a lot. No, I'm not on any medications at all. The worry sometimes with living donation is blood pressure, and they sometimes say your blood pressure may go up. I've touched wood, not had that happen. I have an annual checkup at the hospital where they measure my kidney function, and I've just had that actually last week. I'm very happy to say I'm doing good. In fact, my coordinator said, it's like you've got 2 kidneys still, but I haven't. I've only got 1 kidney. And so, no, I don't take any medication, but Shakti does. Shakti's on immunosuppressant medications, and she will be on that for life. And that's to help her not reject the kidney that she received. So she's on medications, but, she's taken to that like duck to water. She's absolutely fine. And doesn't really think about the medication. She just thinks about being able to eat cheese. That really
Thank you. That's good. It's amazing.
Yeah, it's truly amazing. And it's, everyone that's involved, the doctors, clinicians, the coordinators, and obviously the patient, the donor recipient is phenomenal. And it's so good to see that this is an option now that the community has got, and we don't need to rely just on deceased donors, because we know obviously within our communities that there's such a shortage of them. So it's people like yourself, Prafula, that we do these webinars so we can raise awareness on living donation, and more people come forward from the families for patients.
Yeah, I mean, Bushra, you just made a really important point about the fact that there aren't enough people donating, and the need is greater in this community, in our communities.
Yeah.
So I think, to kind of correct that imbalance, it's good if the community can maybe do something about this challenge that the community faces. And it is doable, absolutely. We just need more people to step forward and say, yes, I will do this for my friend or my family member.
Yeah.
And my final thing was to thank people like Jen and everyone in the NHS who's just done a fantastic job to help people like Shakti and I. But, they do it daily, and they help millions of people daily. But we've had an amazing experience, and I urge everybody to look into it if you've got somebody in your family that's in need.
Thank you. Can I just add to that? I mean, I think we're very lucky to work in the field of living donation. It's such a positive area. And every kidney donor who comes forward, whether it's a family member, we also have altruistic donors who start off the kidney chain, who don't know anybody with kidney failure, but just want to give a kidney to help. And, you know, I think each and every kidney donor, you know, it really is an exceptional gift. And it certainly makes our job so worthwhile to see the difference that you make to people's lives. So thank you. And thank you, Bushra, for organising this webinar and the opportunity to speak. Thank you.
Thank you, everyone. I think, yes, like Mrs. Gandhi had said, it was a very short and sweet webinar. So thank you, everyone that joined, and thank you, Jen, Prafulla, and Dr. Bhatt for speaking today. And our last webinar that we're doing on living donation within the South Asian communities is tomorrow. We'll be hearing from an altruistic donor. I don't know, Prafulla, if you know Surinder Sapal. Yes, she'll be sharing her story with us tomorrow within the Sikh community. So please do join if it's from 6 to 7 p.m. tomorrow. But yes, so I think, yes, we're running on time, so that's great. I think Mrs. Gandhi just wanted to say some closing remarks. And yes, thank you to everyone that joined. I'll just hand over to Mrs. Gandhi. Mrs. Gandhi, would you like to say a couple of words?
Yeah, thank you so much. I'm taken back. Prafulla, I'm really taken back. Such a lovely story. Such a lovely story. I wish I was much younger to do all these things. I knew all these things. I've been into education because I love learning. I love teaching and giving things to others. But my hats off to you, really. And I think we are all learning every day. This is my best lesson in my life I've learned today. Give. Don't think of anything but just give. Thank you. Thank you, all of you joining this session. God bless you, Prafulla.
Thank you. Thank you very much for having me. And just by you doing this and this work with Bushra and the kidney research team, you're going to help a lot of people as well. Thank you.
One thing I want to ask Dr. Bhatt, people who are ill and who have got some kind of ailments and all that, can they donate their body parts? Could they?
I think it just depends on all your, your tests and everything. So it's how ill are you? So obviously, if you've got something wrong with your kidneys, but your eyes are okay, when you're deceased, you could still donate your eyes. But obviously kidneys you have to be quite fit and healthy and be able to live without having one kidney. So I think, it just depends on your tests.
And what about the age? Is there an age factor at all?
A difficult one. Again, you can have a 70-year-old who's fit and healthy and absolutely fine, and they might be a match. But I think, it just depends on your other comorbidities, your other health problems and things.
Thank you. Thank you, Bushra, for organizing all that. Thank you.
Thank you, everyone.
Thank you, Bushra, as well. Thank you.
Thank you, everyone. And hopefully we can still enjoy the lovely weather that we've got here in Scotland as well. So thank you, everyone.
Thank you very much. Thank you.
Take care.
Bye-bye.
Bye-bye.